2 weeks ago, I had excision surgery to remove a 14-centimeter ovarian cyst. The procedure also included removing stage 4 endometriosis, which was present throughout my pelvic cavity. The recovery process has been slow, but I am grateful the pain is less with each passing day. Recently, I came in contact with someone who was very ill and had tested positive for the flu. I did what I could to stay away from the person, but with having a tracheostomy tube and using a ventilator to breathe, just being in the same room with someone for a few minutes is usually enough to get me sick. A few days after being exposed to the person, I was not feeling well. I was tired. Anytime I moved around, my heart started beating fast and hard. I became short of breath and my chest ached in pain. I have a medical condition called postural orthostatic tachycardia syndrome, abbreviated as POTS. With this health affliction, anytime I sit up or stand up, my heart rate increases. I have had this medical condition for many years and I've learned to adapt to it. However, when I am sick, my heart races out of control. I pushed aside the thought that I may be getting sick. It was late in the day. I assured myself I just needed to get some rest. There was nothing to be concerned about. I went to bed. At 3 a.m., I woke up with shaking chills. My joints were exploding in pain. My muscles ached. The pain from my surgery was amplified. My head felt as though it had been slammed into a wall. I took my temperature. It was 100.2 degrees. I swallowed 2 acetaminophen tablets. I continued to shake and fight through the endless pain. At 5 a.m., I took my temperature. It was 101.9 degrees. I had stopped shaking, but the pain in my joints and muscles continued. At 9 a.m., I woke up completely drenched in sweat. My sheets were soaked and my nightshirt was dripping with sweat. When I got out of bed and changed my clothes, I nearly collapsed to the ground because my heart was beating very quickly. For the rest of the day, my temperature stayed around 101 to 102 degrees. I rotated between taking acetaminophen and ibuprofen. Thankfully, as the day progressed, the joint and muscle pain decreased. My headache remained and my pelvic pain from surgery continued to bother me. I slept for most of the day. When I woke up during the night, I was laying in a pool of sweat. I grabbed a towel and wrapped it around me. I fell back asleep. The following day, I had shaking chills on and off. My muscles continued to ache, and I remained feverish. My pelvic pain increased in intensity whenever I moved. I drank lots and lots of fluids. If I left my bed, my heart rate was fast and I was short of breath. I also developed a new symptom. I had a severe sore throat. It was difficult to speak. The next day, I woke up sweaty. When I tried to get out of bed, my chest exploded in pain as my heart raced out of control. My vision went black. I laid back down. I took a medicine called a beta blocker. I waited for the drug to take effect. I then tried getting out of bed again. I made it to the kitchen. I suddenly felt as though I was going to pass out. I raced back to bed. I took more beta blocker. Eventually, I was able to get out of bed. I drank lots of fluids, but my heart rate was still very fast. I remained in bed for most of the day. Over the next few days, my symptoms improved, with the exception of my postural orthostatic tachycardia syndrome. Unfortunately, viruses can trigger a worsening of POTS. Usually, the symptoms improve in time. How long it will take for my body to go back to normal, I am not sure. It sometimes takes 3 to 4 months. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.